Welcome to the Protecting Your Nest podcast. The movement to help as many people as possible achieve metabolic health starts with a foundation of knowledge based on solid evidence to support the recommendations given to the public. Many nutritional studies of the past have been based on non-experimental observational studies which only show association and correlation. Although helpful to guide what the next study should focus on, they don't really show causation. This is one of the reasons so much confusion exists in the field of nutrition. Fortunately, we now have access to experimental studies that are randomized controlled trials which show causation, providing a level of evidence we can trust as we make our dietary decisions. Randomized controlled trials, also abbreviated RCTs, comparing low-carb diets to low-fat diets have clearly and unequivocally shown us that although both dietary approaches are better than the standard American diet, the best diet to achieve metabolic health is the low-carb diet. Thankfully, many organizations which guide our decisions as clinicians, hospitals, nursing homes, or military, etc., and even in our schools, are now learning from these RCTs that a low-carb diet should be one of the recommended dietary patterns for optimal health. We are finally getting there because national organizations are starting to add low-carb as a dietary option, and they include the American Association of Clinical Endocrinology, which made their recommendation in 2016, the American Diabetes in 2019, and the Journal of the American College of Cardiology in 2020, they made a statement about saturated fat. And their statement is the following. The recommendation to limit dietary saturated fat intake has persisted despite mounting evidence to the contrary. Most meta-analyses of randomized controlled trials and observational studies found no beneficial effects of reducing saturated fatty acid intake on cardiovascular disease and total mortality, and instead found protective effects against stroke. Although saturated fat increases LDL in most individuals, this is not due to increasing levels of the small LDL particle, but rather the large particle, which is less correlated to cardiovascular risk. So you can tell that we're starting to get these major organizations to understand that low carb is not a problem and is actually beneficial. Today, I've asked a good friend and previous podcast guest to share some good news. And that good news is that another influential organization, the American Heart Association, has released a scientific statement on March 1st of 2022, stating that low carb is an effective option for diabetics. And it's been a long time coming. As you could imagine, most of us know Ede Fox as the Black Carnivore, and she is active on social media, YouTube, and it has a wonderful podcast herself called The Black Carnivore, where she shares education and support for her followers who are really understanding and appreciating the benefits of carb restriction. Like myself, she's on a mission to help as many people as possible heal from, and in some cases never suffer from, chronic medical conditions that plague society. So I'm so happy to have her here so we can talk about this statement, this very important statement from the American Heart Association that says it's okay to eat a low-carb diet to achieve metabolic health. So with that, Ede, welcome to Protecting Your Nest.
Thank you. Thank you so much for having me. I am actually super excited to be here and talk to you about this because this is huge, huge. And you sent me this message and then I look at it, I'm like, "Wait, what?" I mean, this is like a total turnaround from everything that we've been experiencing, the messaging that we've heard from authorities about health. And I'm like, "Where did this come from? Out of the blue?"
I
What?
know. I know. We're all shocked, amazed, surprised, but most importantly, happy that we now have an additional tool, an additional talking point. So when I'm talking to my clinicians, my patients, and they're so afraid, and to be honest, even in my own health system, there are probably people that think I'm some kind of quack doctor. to suggest a low carb or keto or even carnivore diet. I must think I'm, out of my mind. So now we are starting to give people permission that it's okay. Not only is it okay, it may be one of the best approaches to achieve optimal health. So I'm loving that. I appreciate you being here. And I who better to talk about this topic than a good friend? And that's you, Ede. So thank you so much. And let's start our conversation. And I want to make it a little personal because there are three men who have meant a ton to me over the years, and who have all kind of suffered from vascular disease. Two of them are my dads. I have a stepdad and I have a father-in-law, both who had heart attacks in their 50s. And when you're like 53, that really resonates, right? One also later had a stroke, same disease, vascular disease. Another later developed dementia, same disease, vascular disease. And I also have an uncle who even taught me how to drive, who ended up suffering from dementia. So, but all of these conditions are really due to too much sugar or starch or too many grains, leading to hyperinsulinemia, leading to metabolic syndrome and metabolic dysfunction. And the good news about that is that they're all preventable with lifestyle interventions. So I couldn't imagine again having a heart attack in my 50s now that I'm there. And I'm curious for you, has cardiovascular disease, heart attack, stroke, dementia, any of that stuff, has that impacted your family as well?
Yeah. So, my family has struggled with, sugar, as we, call it, and high blood pressure, and cancer and some dementia, but it's, really more of those that have been the big part of it. And my grandfather actually had, I think, two heart attacks when he was
Mm.
younger, but then died at 70 from lung cancer. He did also smoke, two packs of Marlboros a
Right.
day, for many years. But yeah, and he drank alcohol, which, a lot of alcohol, which really also kind of functions in the body like sugar. And so I do have to think like, okay, he wasn't, for like some people, eating a ton of like fast food and sugar, but there
Mhm.
was the alcohol, which, was essentially functioning the same way.
Yeah, and alcohol has definitely impacted my family. In fact, I would argue alcohol, of all the toxins, is probably the one that's impacted my family the most.
Hmm.
And it's unfortunate. Cancer definitely has impacted my family. And again, Ade mentioned cancer because it's a metabolic disease in most cases, and cancer cells favorably use glucose as their fuel, and that's called the Warburg effect. So yes, cancer and heart
Hmm.
disease and stroke and dementia. Again, many people have heard type 3 diabetes. So, yes, all of this is related. That's why all these dietary recommendations are critical. Like you
Hmm.
said, they're huge in terms of what they would mean for our friends and family. So, let's talk about,
Well,
diet. Yeah.
to jump in too, like, for me, for anybody who's watching and who maybe hasn't had an opportunity to hear more about me or what I talk about, but really, I'm on a mission to, help a million Black women reverse
Yes.
disease, lose weight, and end like chronic pain and inflammation. And I do that because that is the picture, the exact picture I saw of all of the women around me, my mother included. And I was also on that same track. And so, when I look around, like that's really what I see happening, and not only, I mean, in the Black community for sure, and everywhere, but I really want people to like be able to get off medications. And I discovered this way of eating and found that I was able to turn around all of these things and to feel, like 10, 20 years younger. And I want everybody else to really be able to experience that and to know now that we've gotten this groundbreaking news from the American Heart Association that they too acknowledge, albeit they said it quietly, that this is, a carb restricted option is, is a viable choice to make your way to optimal health. Now that that's said, like I want to get that out there and make sure that all the people, at least in my peer group, understand and know that this is, this is huge news.
It's huge, and first of all, I have a Black mom. I have a Black wife, so I appreciate you targeting that audience because kind of underserved. Sometimes they don't get this information. Even in the low carb community, we're kind of outliers. There's not a lot of people of color in the community sharing this healing message. And before we go to the next thought I have on my brain, shout out to Dr. Kim Berry. He actually, I kind of poked you about this news with Dr. Kim Berry. Put out a video about this AHA caves on low carb keto. And I'm just thankful that he's out there spreading this message as well. So I want to do a shout out to him for helping to heal people, Dr. Kim Berry. So, but let's move on to kind of the same talking point, to be honest, this idea of, how our families make dietary decisions, right? And to be honest with you, they and everybody else in society, they're guided by these large organizations that guide our decisions. And American Heart Association is one of the biggest and most impactful. But just a little history lesson. Back in 1901, a German chemist named Wilhelm Norman was given the task of, let's make some oils for all that machinery in the submarines. And there was only 100 submarines that he was making this oil from. And they found that it wasn't really profitable. So he decided, we may want to get this patent out to a company that can really use it. So they sold the patent, and guess who ended up with the patent? Procter and Gamble. And they actually used the patent initially, that oil, to make soap. But again, back in the day, which is hard to imagine, back in the day, a lot of people made their own soap. Could you imagine that, right? So it wasn't profitable for that purpose as well. So all of a sudden, Procter and Gamble said, well, there's a solution. How about if we take this oil, and ironically, this oil is made of cottonseed. I want to emphasize this cottonseed is not really something you would have consumed. We're going to turn it into lard for cooking. And it was influenced by Ansel Keys. And the reason why it was easy to sell this way of using it for oil is because saturated fat was being demonized, primarily because of Ansel Keys. And there was this thought that trans fats are okay and healthier than saturated fat. So, and it was also the marketing that Procter and Gamble did with their Crisco. They said, well, it's not animal fat. It's purer than large. It's easier to digest, etc. So, but the most important thing I think that happened that helped to get Crisco out into the world by Procter and Gamble is them giving a $1.7 million check to the American Heart Association. And that led to the American Heart Association endorsing this product as a healthy alternative. So now, again, they may not have known, and I'm fairly certain that back in the day, they didn't really know that the trans fats was an issue, but they certainly put it out there. And then, as we know, millions of people, I would argue, ended up having heart disease because of this. So when you hear this story, Ede, what comes to mind? What thoughts make you, what do you think about?
I think that you're more generous than me. Because, I think that any normal human can understand what is food and what is not food, and, what substances you're supposed to consume and what you're not. And I would go back even further and say, like the Weston A. Price Foundation, looks at the dietary and subsistence patterns of various human populations around the world at contact. And so we have some sense of what indigenous populations were eating in lots of places around the world. And you habitually see that when they start eating the westernized foods that are introduced, that their health declines all the time, everywhere. And enough that, 100 years ago or whenever, they started the foundation and started publishing, they were seeing and were able to say, within like a few years, not generations, but years, like, wow, this population, they
Mm-hmm.
used to have great teeth. Now they're all falling out. And so even then, I think that the powers that be understood that there was value to be made in getting a population of people off of their indigenous, subsistence patterns and getting them to pay money for, some product that was, imported and brought to them. And I think that process is happens everywhere, and it's happening, to this day. So, um, I'm less generous. I think that, anytime you have someone creating or processing a product, the idea is not about feeding the population. The idea is about how do we make money? How do we make a product that people have to
Hmm.
come back to over and over to purchase? And so that is why, I really encourage people, like, stop eating anything that came in a box or a bag,
Right. That's
like
right.
this is it's not food. Food is something that, someone 200 years ago would also be able to recognize as food.
That's right. And the irony is that because I spend time watching the Animal Channel, right? And I think about those cats, those leopards and lions and things like that, and even the dogs that are wild. Um, they're not eating stuff out of the box. I would argue even our precious cats and dogs that we have in our home shouldn't even be eating that crap that's in a box. I mean, it's just a ridiculous. If you look at the ingredients, it'll blow you away. So we have to do better. One of our good friends, speaking on the same subject, Nina Teicholz, who we both love and respect, and again is legendary in my mind in terms of getting this message out. She was quoted saying that the fear of saturated fat, she couldn't even imagine a single policy that has caused more harm. The irony is that even a few years ago, a cardiologist, John Warner, with the American Heart Association, ended up having a heart attack. And I mentioned earlier how I couldn't imagine having a heart attack in the 50s. It was 52. But yet he's leading the American, Heart Association. And yet you would think he would be the expert at preventing his own heart disease. So when you hear that story, what comes to your brain?
I agree. I mean, these are horrible policies. Now, admittedly, America has lots of horrible policies, so I don't know
Right.
if this is the worst one, but I'm going to say it is pretty bad. And one of the things that I really liked about what Nina Teicholz has talked about in her book, The Big Fat Surprise, was that these policies around diet were really designed around middle-aged white men who were dying of heart
Mm.
attacks, and they were being
Hmm.
applied to an entire population, from babies, to women to whatever. And so, a policy that, sort of wasn't, may actually be harmful to children and really doesn't, reflect what women need, was being applied to everyone. And so we're all still today, being told to follow a diet that is, supposedly relevant for a middle-aged white man. And I recently did an interview with Diana Rogers,
Hmm.
who wrote the Sacred Cow, about this latest policy about New York City having, well, we already have meatless Mondays, but now, what was it, vegan
Friday.
Fridays? Yeah,
Yeah,
vegan
vegan Friday.
Fridays.
Yeah.
And and how alarming that is. I mean, basically we're taking away nutrition from, a population that needs it most. And and that really concerns me. So I think that, these are the kinds of policies that really are negatively harming us, because, they're directly impacting our next generation.
Mhm.
And then there have been studies that show that, kids who eat animal products actually do better in school. So, I mean, that's like a really big deal, and we're talking about a million kids in the New York City school system. So, and
Yeah.
I know when I was a kid, I was like trying to eat as much junk as possible, or that I could get my hands on. So if I were not being offered, some healthy things along the way, like, I shudder to think what I would have been eating, like bags of popcorn and, like, I don't
Mm.
know,
Yeah.
and pizza.
Yeah.
I mean, I don't
Right.
know.
That's right. And
Yeah.
it's crazy. And I really do want to again mention Nina Teicholz just one more time and just let people know if this speaks to your heart and you believe in what we're talking about, maybe supporting the nutrition coalition, which Nina Teicholz has started, and they're just trying to make sure everything that we do is evidence-based. We're assuming that the American Heart Association shifted because they started to look at the evidence, and that's why they had to shift and not deny, remove their blinders and look at the science. And the science is clear that a low-carb diet is beneficial. But I would actually go to the Nutrition Coalition's website and support the work she's doing. Just as importantly, read the work that she's doing so you can get some clarity about how you should look at some of these things that we're talking about. So let's dive into the American Heart Association statement. I'm definitely going to have a copy of that in the show notes. I actually have it with me here. As you can see, I got the paper. It's kind of hard to see if you're watching this
Me
on
too.
YouTube.
I got it here
Yes.
and I marked it up.
Yes, good. Okay, good. And I love that. You got to mark it up. And it had it's got a nice abstract that summarizes some of the conclusions. I want to kind of skip to the second page, which is, in fact, I'll hold that up for those who are watching. And it's a nice little figure here on the second page. I really love it. And what I love about it is it's entitled cardiovascular risk reduction in adults with type 2 diabetes. But I love it because it focuses on, not just medications and lowering your cholesterol and your blood pressure to reduce your risk for cardiovascular disease and diabetics, but it also talks about, access at the bottom. There's a part that talks about the social determinants of health, back like right on the bottom. And that's huge because if you're going to help people heal, this is why I have a nest in a rope acronym. You have to deal with other aspects of their life. So when you look at this, it talks about, health equity is on the title at the top, for example, health equity across populations. That's important. And access to care, things like that, and education, economic stability. I love that. And I'm somewhat shocked, but I think we're learning in healthcare that if you don't address social determinants of health, you will not help people to heal. So when you saw that figure, Ede, what emotions did you feel when you saw it?
I mean, I was really surprised at how inclusive, they were trying to be in this statement. And, and I think that, I mean, for me, I love low carb. I think it has been super helpful. I think I've seen it really turn around a lot of people's lives. But I, more importantly, want people to know that there are many avenues to health, and you have to find the right one for you that is not only, most effective, but also most sustainable and enjoyable. Because,
Hmm.
you have to, like, all of this stuff has to fit into your life.
Hmm.
And so I really think that this is the first time that I'm starting to hear, like, this whole conversation of building out a strategy that works for your life and picking out the options or the tools that, most work for each person. So while I think that low carb is awesome and could work for anybody, I recognize that there are different people who have different desires. So some people want to take a different route. They may want to take a
Hmm.
plant-based route, and if it's working for you, go ahead, great.
Yeah.
But I really want to speak to the people who, who have been trying to do the standard, advice, and it hasn't been working for them. I think that, if you've been trying to do low carb, low calorie, low fat, and, and you keep finding yourself every, 4 or 5 days, like diving into a pizza and a bag of popcorn and a bucket of ice cream, then, that may not be, your lack of willpower, but that may
That's
actually
great.
be a problem with the approach that you are taking, and you are not eating enough calories and food,
That's
and
great.
your body is like, you've got to give me some energy, and I'm going to force you there. But if you stop fighting your body, it might be a lot better. But the other thing that I did like, that there were these social determinants of health. And one thing, like, specifically in the Black community, I feel like there is, perhaps a greater level of skepticism about the medical industry. And so
Hmm.
I think that we really have to speak to that specifically. And I feel like in the family that I grew up in, there was sort of a range of beliefs about the medical industry. And my mom was, very focused on getting the finest, the top educated, the person from the top school. And, in the process of her death from cancer, I really started to, really question that, and she went to the finest institution for cancer, Sloan Kettering. And the doctor there was the finest with the finest
Mm,
education. And he basically was like, well, the book says, according to your, genetic, specific genetic mutations, this is what's going to happen. So we're not going to give you treatment and we'll make you
mhm.
comfortable until you die. And across the street, I mean, and I'm calling out these hospitals. This is just me. So this is my opinion for everybody who's watching. Please don't, attack this podcast host. But then we went across the street to, to Cornell Weill, and there was a doctor there. She was older, and had kids and more, I think, life experience. And she's like, yep, that's what the book says. But, people are people, different stuff happens. So let's treat you and see what happens. And then, my ended up living a year longer than she was expected to, and did
Mm,
respond to the treatment, even though it was expected that she wouldn't. And, all of that said to me, you really got to have the right person who is willing to
mhm,
be a partner with you on health and listen to you and experiment with you. So instead of that person who's like, nope, the book says this, I'm not doing anything different, you got to let that go. But, so many of us, I feel like, have encountered that person. And one
mhm,
of my, so I do a lot of like health coaching and helping people follow the carnivore diet. And one of the women that I work with, has type 2 diabetes, and her endocrinologist flat out refused to work with her on getting off of insulin.
mm,
So she, talked to her doctor, but, and of course I told her, look, you got to do this in partnership with a
mhm,
doctor, but she's getting off her insulin on her own. She's kind of figured
mhm,
out a schedule and she's working on it. And so this past week, she had like a couple of low blood sugar moments, which, I don't think she like recognized what a huge, accomplishment this was. I mean,
mhm,
obviously dangerous, but also a clear sign that her blood sugar was dropping significantly. And so she really is still working on doing titrating the medicine. Again, I totally understand that you should not do this. For those of you
Right.
watching, you
That's
need to
right.
do this with a doctor. But the fact is, there are a lot of us who don't have the doctor who will do this with us. And
Yeah.
yeah, so I don't know. That's my rant.
But that's what we're hoping to change because and you're absolutely, totally appropriately ranting, because it's very emotional, and you have people who are trying to get help and they can't get help. The doctors don't have the education, but the good news is this is why this statement is so important from the American Heart Association. We need to remove this fear of fat. We need to remove this fear of keto, low carb, and carnivore so that the clinicians themselves will feel more comfortable. And again, in my health system or any other in the country, we're outliers. We're considered outliers by suggesting keto hills, but that's about to change. And so I'm just it's going to take time because guess what? I didn't see breaking news on CNN about this topic. I literally searched, and other than Dr. Ken Berry, and it'll probably be us after that, there was nothing that I found talking about this topic. It should have been breaking news that on
Hmm.
March 1st, 2022, the Heart Association has turned this ship completely around. So I just want to say that. And also, I want to comment on I learned the fear of the healer is, I think it's pronounced iatrophobia. So there's a fear of the healer in communities
I
of
did not
color.
know there was a word for that.
There's
So
a
thank you.
word. That's because it's a real thing, right? So, and we need to understand that there's legitimate fear of the healer. And I remember when I talked to Rashard Johnson, one of our presidents at our hospital, African American male, and we talked about Marion Sims and the guy who made the speculum and how he was doing C sections on women of color without anesthesia. And we talked about I think Margaret Sanger, who was targeting women of color for birth control. Once they weren't, we can't have
Sterilization, right?
right sterilization because we don't.
Yeah.
There's no value in having a person of color anymore now that they're not slaves anymore. So that and syphilis experiments, et cetera, but there is a fear of the healer. So iatrophobia, that's your word for the day, Ede. And we'll educate the masses with that. But yeah, so thank you for those beautiful points. And let's go to the pages that I mentioned from the document are based on the actual document, not the pages when you print it from the link I share. And it talked about lifestyle. One of the quotes: lifestyle modification is a critical component of cardiovascular risk factor reduction in adults with type 2 diabetes. Lifestyle management of type 2 diabetes includes diabetes self-management. And what you just described was self-management, right? She said, I'm going to try to fix this myself. So we need everybody listening who suffers from chronic medical conditions to do some self-management, but also with education and support. That's why we need clinicians to do this with you, including nutrition therapy, physical activity, smoking cessation, and psychosocial care. Again, is how we think, right? And some of that iatrophobia is because of how we think. That's why we have a rope, life experiences, right? That E. The E is also for our emotions. The nest has a T, trauma, right? So I've been traumatized by this society that doesn't treat me equally. So I don't trust. I have iatrophobia because I don't trust. So all of these factors, that's why it's important that they mention that stuff. And they say in adults with type 2 diabetes, greater adherence to an overall healthy lifestyle is associated with a substantially lower risk of cardiovascular disease and mortality. I think we're preaching to the choir with this statement, Ede, but when you hear the American Heart Association give a quote like that, what comes to mind?
I mean, it's just funny because it sounds like, it's sort of like they're saying, "Of course we know this, so therefore, the next belief is true," as if they hadn't been opposed to that statement, for the previous, I don't know how many decades. So it's just, I feel like it's funny that they're just slipping it in, like, "Yeah, of course we
Yeah,
always believe this."
that's right.
But, I mean, beggars can't be choosers. It's here, so let's
Yeah.
let it out. Let's embrace it. Yeah.
And it's cleaner. I mean, if the history I gave about how they help to promote something that's harmful is true, and we know it's true, then you have to kind of slide this different way of thinking in. And I think that maybe that's their way of doing that. But I'm just, again, happy. One thing about me, I'll celebrate when you do something right, even though I may have some opinions about your intent, but I'm going to celebrate it because I'm just trying to move us forward. So I definitely appreciate that statement. Now,
Hmm.
on the same page on 724, and for those, I'm mentioning pages, so if you want to grab the document, print it while you're listening, feel free to do that. And the beginning of uh, page 226 by the American Heart Association. When it comes to groundbreaking news, this is the part that really resonated with us, and you would think that it wouldn't be that big of a deal. But anyway, it says healthy dietary pattern is recommended to improve glycemic control, logical, achieve weight loss when needed, logical, and improve other atherosclerotic cardiovascular risk factors. The the ADA recommendations support various healthy dietary patterns, and maybe they meant AHA, to achieve glycemic control and weight management, although effects on dietary interventions on cardiovascular outcomes in individuals has not been widely studied. That's an interesting statement, but I'll keep for it. This idea that diets that improve type 2 diabetes has not been widely studied, that's, I'm going to pause and reflect that. When I think about um, dietary patterns that have been studied, there have been a gazillion low carb versus low fat studies studied. And when you look at those studies, they always mention cardiovascular risk factor markers. They always mention, A1Cs or whatever. So I'm not 100% sure why they would say they haven't been studied, or they may be just saying maybe they at the level of time that's necessary to make conclusions. But I can
Mhm.
assure you there are plenty of studies that have been studied. But at the end of the day, it's nice to kind of pause for a second and think about that concept. So when you
Mhm.
think about, I know carnivores in the beginnings of a lot of research, but when you've done your research, when you got into low carb, have you found that you saw enough evidence to support that way of eating?
Well, was looking at the evidence around a ketogenic diet. So, what I remind myself and other people is that a carnivore diet is a ketogenic diet. So the benefits that you're getting, from the diet are coming, or all the benefits that are described for a ketogenic diet are coming to, somebody following a carnivore diet. And then there are some additional benefits I think that come specifically from refraining from eating from the plant kingdom. So I interpret, I read these studies about about a low carb diet and apply those same benefits to myself.
Cool. And
Hmm.
that makes a lot of sense. And I agree. And that's why um, the short-term benefits, I have carnivore patients, and the short-term benefits are kind of clear. They lose weight, they get off medicine, blood pressure is normalizing, diabetes goes away. So, man, if there are some long-term side effects, that's going to be hard to imagine when you correct all the things that are supposedly the risk factors for those long-term complications. So thank you for
Hmm.
that. But the bigger statement in this report that was sent out by the Heart Association was also on page 226, and this is what really made us pause and say, "Wow, this is really good to hear." And the quote is that the Mediterranean, the Paleolithic, the low carb, and that's where we pause because we never saw that, high protein vegetarian and nut enriched diets, not sure exactly what a nut enriched diet, have all demonstrated benefits on glycemic control and weight loss and type 2 diabetes. And I think that's a huge statement. It was the first time that I'm aware that the American Heart Association has clearly stated in anything I've read that it's okay to consider a low carb diet. And that's a huge statement because it does allow us to say to the public, say to the hospitals, say to the people that provide food for our babies at those schools in New York, wherever, that it's okay to consume a low carb diet. So if you're hearing this for the first time, and you've been afraid of consuming a low carb diet or keto or even carnivore, now you have permission from the American Heart Association. Now you have permission from the American Diabetes Association, which did it at the end of right before the pandemic in 2019. Now you have permission from the Association of Clinical Endocrinology that did it in 2016. And now you have permission that saturated fat, which tends to be in a low carb, keto, or carnivore diet, that saturated fat should not be avoided, but embraced based on the American Journal of Cardiology. So now you have these large organizations saying that Dr. Hampton and Ede Fox, the Black Carnivore, we're not crazy. We know how to read science. We know how to look at journals and understand what they're saying. And again, when you looked at randomized controlled trials, this was fairly obvious to many of us. So having said that, AJ, when you got that message from me that wow, this is the new breaking news, what feelings came to you when it happened?
I mean, I was just really excited that all the people who are like, who say, but what about my cholesterol? Isn't this all
Right.
of this going to make me have a heart attack? That I'd be able to say, the American Heart Association says no. It says this is a viable option. And if you enjoy this option, you can do it. And I think, you know, I mean, I guess it's taken, I don't know, 30 years to like beat this
Hmm.
message into our heads. But I remember when I was like a kid and people started talking about cholesterol and, don't eat cholesterol. And, my grandmother was kind of like, shut up, and go eat your Brussels sprouts and here's the butter to put on top of it.
Right.
But over time, she started to say cholesterol, cholesterol without knowing what it meant, what she was supposed to do about it. But I do remember she bought a bag of popcorn and she was like, "Oh, this is good because it says it has no cholesterol." And I was like, "But this is a product that doesn't have cholesterol." Like,
Hmm.
people. I think the marketing started happening in the '90s and the early 2000s, where that word was just printed on everything.
Hmm.
Things that traditionally don't have cholesterol are now being
Hmm.
touted, no cholesterol. And so, this sort of contributed to this fear of this concept and this word that people didn't really know what it meant.
Hmm.
And even when, you have people like asking these questions about, cholesterol and dying of a heart attack, and the evidence isn't there that, that you will, that high cholesterol, or when you look at the people who die from heart attacks, right, the evidence isn't there saying that high
Hmm.
cholesterol is always a cause with them and that,
Hmm.
the cholesterol numbers are all over. And I think that, having people like reconnect with like the people who are dying of heart attacks, what's happening with them, because that's what we care about, like the ultimate outcome, and not like these sort of statistics about what might happen
Hmm.
and what could happen. And yeah, so we've sort of been bullied and scared with this word without really understanding its meaning. And so when I try to push back, like the person has to have some willingness or interest in having this conversation and learning something from or being open to hearing an alternative perspective.
Hmm.
Otherwise, there's not really a way even to have a conversation and to question what this other person believes. And so this is at least one way. When they say, but what about cholesterol, you can
Hmm.
say the American Heart Association said
That's
this, it's
right.
on page so and so if you care to
That's
read it.
right.
And
That's
then they're
right.
never going to read it.
Right.
And then they'll say, okay.
Okay. That's right. It's huge. And even
Yeah.
my wife came home this past week with one of her coworkers with, who not with her, but she had a bag of some product and she was only consuming that product because it said low fat. That's the
Mm,
only she was like, "Oh, it's low fat, it's
mhm,
gotta be good for me." Of
mhm.
course, it was a ton of sugar and carbs in it, and this person's on a journey trying to heal, so that's why this is so important, guys. We have to, at the minimum, give people dietary options, right? Like, so you don't have to be carnivore, keto, low carb. As Ade mentioned earlier, if vegetarian, vegan works for you, have at it. But to demonize something that clearly is not harmful and is beneficial is on the verge of malpractice. I mean, it just doesn't make sense. So I completely agree, and that's why, again, this statement is so important. I was looking at the paper, and again, on page 726, the quote is that very low carb. And keep in mind, they said very low carb diets. That means keto, guys, right? So it's not just
Yes.
low carb. They're saying keto is okay. They don't say keto because they probably are
Mhm,
still afraid of that word. But very low carb is keto. We're
mhm.
effective at reducing A1Cs over the in less than 6 months, and they saw less differences with the studies they read over 12 months, although I don't even agree with that. But I think that and they're saying for individuals using very low carb dietary approaches, it's important for health professionals like myself and people advising others to maintain medical oversight. We talked about that earlier, and adjust diabetes medicines to prevent hypoglycemia. So think about this, guys. This dietary approach is so effective that your biggest problem is your sugar going to be too low. And in the old way of thinking, we would say to people, well, you need to eat all day like a cow because your sugar is going to drop. And how backwards is that when you can simply say, now that you're eating right, you can reduce your medicines or get off your medicines. So let's reverse how we think and stop that old way of thinking, which is really not helping people to heal. And so having said that, I think that that's why the guidelines for therapeutic carb restriction, which is provided by the Society of Metabolic Health Practitioners and Low Carb USA. So if you go to their website, you can find the guidelines that you can give to your doctor to show them how to safely reduce carbs in your life without getting the side effects, which happens to be good things, like your pressure is going to drop, your sugar is going to drop. And I actually did for my health system, for Advocate Aurora Health System, I actually did a presentation about a week or so ago, where I actually walked through the guidelines, step by step, so my clinicians within my health system are able to understand how to do that. So,
Hmm.
so you know, so you're in the carnivore community and people are healing. When you talk to people about their healing process, do they also have to worry about the same issue, which is that, they have to have adjustments of their medicines? What kind of
Hmm.
conversations have you guys had around that?
Well, I do really encourage people, like, you got to go and deal with your doctor around if you're on medications. That's one of the first questions that I ask people when they come and want to work with me on implementing a carnivore diet. And so if they are on medications, I tell them, you have to work with your doctor. This stuff is going to change quickly, like within weeks. And, you got to deal with it. One of the things I do a monthly challenge now. It's a 21-day carnivore challenge. And I can't tell you how many people have dropped their high blood pressure, 20, 30, 40 points in 3 weeks' time.
That's
3
crazy.
weeks' time. And so it's not even about the weight loss. I mean, in the
Yeah.
in the statement, they are kind of tying all of these benefits to losing weight. But it's not about the weight loss. Like, the people are losing maybe, 7 to 11 pounds. So it's not like this huge thing. But
Right. That's
all
right.
of these physical changes happen so quickly. And I find they happen quicker on a carnivore diet. And one thing
Hmm.
that's weird about carnivore is that, it is a weight loss diet, but the weight loss, well, I should say it is a lifestyle diet. It's a healthy way of
Hmm.
eating. If you need to lose weight, you will lose weight. If you need to gain weight, you will gain weight. But the weight loss on the scale is not quick. But the healing benefits are very quick. So within, 2 weeks, you're already going to be noticing higher energy, feeling better, blood pressure getting more under control, blood sugars normalizing, mood improving, and all of these kinds of things. And so, to me, that tells me, like, if you have this massive a level of healing, I don't know how you can decide that this is an unhealthy diet. Anything that makes you feel better,
Hmm.
and a global better, not just like a high from cocaine or something, but like, sleeping better, more energy, happier, not hungry, able to think more clearly. Like, when you have that kind of global healing, how can you say that this is a lifestyle that is unhealthy and will ultimately kill you? And I think that people are starting to get that, and so they're wanting to implement it.
Yeah, and
Yeah.
it does seem weird to only lose 5 or 10 pounds and have that impact, and then you start to pause and say, "Well, why would that be possible?" One of the people who start this dietary approach, and most of whom, particularly in America, we're all kinda like hard, addicted to sugar and starch. So we have to it's an addiction, so we have to go through a little withdrawal, and one of the things that happens, because carbohydrates, and I tell my patients, carbohydrates, it has the word hydrate in it, it attracts water and salt. Oh, so if I have low carb, I'm going to get rid of water and salt. That may lower my blood pressure. And that's one of the reasons why people get
Mhm.
keto flu or carb withdrawal. The inflammation takes longer to settle down because you have blood vessels that make nitric oxide. The nitric oxide allows your blood vessels to expand. So it takes time to heal that inflammation in your arterial wall so that you can make the nitric oxide and expand. However, you're going to have other things that happen fairly suddenly. So going back to salt, if you have hyperinsulinemia because you were eating the starch and sugar and too many grains, well, the hyperinsulinemia is going to cause you to have salt retention. So if you get rid of the hyperinsulinemia, you won't have salt retention in your kidneys. So I could imagine not only having some symptoms that you would feel, but that I can see how your blood pressure can drop if you stop retaining salt. I also, and that's why people eating this way have to add salt, ironically. Oh, the
Yeah.
doctor's saying add salt. That's crazy. That doesn't sound right. And then another thing that happens kind of right away, when you lose weight, you're not going to just lose that water weight and you stop retaining salt. You're also going to have your liver fat. A lot of people who are struggling with chronic medical conditions, they're going to have a fatty liver. Well, your body's really smart, and it's going to say, well, we got fat on the body, but let's get it out of the organs first, right? So when you start removing that fat out of that liver, that's going to be helpful in terms of reducing. It's going to increase nitric oxide, which will then lead to a reduction in it's going to increase uric acid, which will then reduce nitric oxide. It's I think I'm getting that backwards. You're ultimately going to end up with more nitric oxide. So excuse that little confusion there. But ultimately, it's too much medical stuff in my head. So ultimately, no fatty liver. You make more nitric oxide so that you can expand your arteries. But what I'm saying is, it all kind of makes sense to me from a doctor perspective, and I just love the fact that we're in a place where people can start getting these benefits. And I do want to, I kind of skipped over the abstract of this document. And in the abstract, it talked about, the evidence and clinical utility of the newer anti-hyperglycemic agents in improving glycemic control and reducing your risk for cardiovascular events. It talked about the impact of blood pressure control on cardiovascular events and diabetes. It talked about the role of the new lipid-lowering therapies in comprehensive cardiovascular risk reduction in people with diabetes. And I mention those things because it's still very medicine centric, right? And literally in the abstract, they didn't really focus on the nutrition part until you go into the article, right? So it's kind of hidden. So, and guess what? What do clinicians read when they read articles? Do you really think they read 36 pages? Do you really think they do that? They don't have time for that.
I know I started with the abstract and then the
Right.
conclusion.
Right.
And then I wrote
Exactly.
back to you like, "Well, I don't get it. Why is this
Right, right.
so
Yeah,
important?"
you did. You were like, I don't what's the news? I was like, and I had to point out page 724 and 726 because they hide these things, and they it's almost like they don't want to say it, but they have to say it. So but you know what, I mentioned this abstract because is it true that the newer diabetic meds and lowering your cholesterol and all that, your blood pressure, all these things going to be helpful? Yeah, of course they're going to be helpful. But my experience is that all of those things get better with lifestyle. So if all of these things get better with lifestyle, that should have been the highlighted part of the abstract. But instead, we're still focused on being medicine centric. So your thoughts on again, you have people in the carnivore community getting off medicines and things like that, and what kind of experiences have that led to it as people are sharing? I've listened to your podcast many times, and I hear their testimonials, and they're almost expressing it with like tears, and I never hear them say, man, that foreman did it for me. It's like they never say that. That insulin, when I got that dose right, that did it for me. So what's been your
Mhm.
experience with that?
Well, I mean, I watched my mother struggle with metformin and never could get like the dosing right so that it didn't
Hmm.
cause a lot of GI distress. And ultimately, I think she just stopped taking it because it was just too, it was just a mess.
Hmm. Yeah.
And so, but so many people have wanted to get off medications in my community. And just last week, I do a live stream every Thursday on my channel, and one of the members of the community, on YouTube, you can give a super chat if you on the live stream. If you really like,
Hmm.
what the person is saying, you can give money. And he gave me $99. And I was
Wow.
like, wow, thank you. And he
Yeah.
said, I spent way more than this monthly for my diabetes medication. every month for years. So I don't care. This is totally worth it. And so, as I talk to people who, want to come and work with me, I do have a more intensive coaching program for people. I do ask the question, what is the true cost of not dealing with these illnesses? I mean, there is the cost of like the medications that you have to get every month, and that can be a lot depending on your insurance. Hundreds of dollars, and then but also, what's the cost of having multiple sizes in your wardrobe for all of the weight you lose and gain? What's the cost of not getting that promotion because, you're not able to be fully present at work, or,
Mm.
you don't have the look or the body that,
Mhm.
society has decided a manager should have. What are the trips that you haven't taken because you don't have the energy and you don't feel like you can, well, like Europe requires all this walking, like going to museums and all that stuff. So what are the things that you're not doing, and what is the true cost of that each month? And then I think that is what you really have to judge, like, whether whether a method is working for you or not. And
Yeah.
and that's a hard thing to look at. Like, those are hard questions to ask, but I think it is, it's really important to really look at your overall life. What are you missing out on because you're not dealing with or finding the right, you know um health journey for yourself.
Yeah, that's cool. And ironically, you talk about those things, and the next thing that I noticed in the statement they made on page 742, in those with established, cardiovascular disease, the highest intensity statin, going back to medicine, tolerated should be initiated or continued with the aim of reducing the LDL cholesterol by at least 50%. And then you have to individualize the approach if you're over 75. I wonder why they say you have to individualize. It's because when people are, the older you get, the more the side effects are going to kick your butt. That's why.
Mhm.
So the and for primary prevention in type 2 diabetes, at least moderate intensity statin should be considered based on age, absolute cardiovascular risk, or the presence of risk enhancing factors. Now, I don't disagree that if you're type 2 diabetic, you should, be thinking of it. But should we just give everybody a statin? Now, in practice, most people who are diabetic are being asked to take statins. That's how it works in the real world. But how ironic is that when you consider one of the side effects of statins that increase your risk for diabetes? How ironic
Ugh.
is that? That's pretty interesting, right? Oh, by the way, so many patients can't tolerate it because of the muscle aches and the muscle pain or the nausea. Oh, by the way, it affects your memory. And since dementia is a big problem in the world, do you really want to take something that's going to impact your cognition? And then in some cases, it can affect your liver. So it's really something you really have to pause and ask yourself: does it make sense to start off with medicines that have all of these side effects? But another thing about that statement I mentioned is that they were focused on the LDL cholesterol, right? And we already know that focusing just on the LDL, the so-called bad cholesterol, is probably not the most effective way to identify risk for cardiovascular disease. We have triglycerides in our so-called good cholesterol, the HDL. We have apolipoprotein BNA ratios, and there we have other things that we can do. So I think part of the messaging for the future, as we try to continue to improve things, can we get the American Heart Association to stop focusing on the LDL in isolation, which is wrong, and I can say that publicly? Can we also get them to really put the emphasis on lifestyle as the first intervention as well? So I just wanted to touch on that just a little bit. I know you hear a lot of talk about, the negative effects of statins, the fact that they focus on the LDL. Any thoughts on those topics?
Yeah, I mean, what I liked about, like, this focus on the lifestyle factors as well is that I think a lot of times we feel powerless, a lot of the
Mm-hmm.
reluctance of going to the doctor is being told all this stuff and then not even being able to participate in a discussion about what
Mm-hmm.
the treatment plan is gonna be, and so, so we feel silenced and, ignored. And I think that when you start talking about lifestyle factors, that's empowering. I can
Mm-hmm.
choose what food I'm going to put in my mouth or not. I can choose what activity I'm going to do
Mm-hmm.
or not. And so I think it's helpful when that is being, put in such a prominent place in the discussion about how to treat disease. And I personally have seen all of these factors, just like you said, just turned around in a
Mm-hmm.
really quick time period. And, we're not talking about like years, in some
Right. Right.
cases, we're talking weeks or months. And so it's not that hard, to do. And I would argue if you like, meat and eggs and butter, it is tasty, delicious, and super easy to do. So, once you let go of the brownies and ice cream, this is not hard. There's no
Yeah.
hunger and nothing else. So, yeah, those are my thoughts. And I don't want people to have to be on medication forever. As you were saying before, I think it can be a helpful tool if somebody has a long, weight loss journey. They've got a lot of things going on, and it may be a helpful tool. But if somebody is younger, doesn't have so many, risk factors, and maybe has a little more time, I guess you would say, they may be able to, to go forward. But that's a discussion to have with a doctor who does want to be your partner, like Dr. Hampton.
That's right. And
Yeah.
I want to emphasize your emphasis on making sure you partner with somebody. If you listen to any podcast, YouTube video, those are not unless somebody watching or listening is my actual patient. I'm just out here helping you think about things in a way that you may have not heard. This is not medical advice, but it does give you some tools to start thinking differently and help you along your journey. Because another statement that was made on page 744 talked about traditional management to reduce risk or delay advancement of kidney disease includes glycemic control, blood pressure control, and renin, angiotensin, and aldosterone system inhibition. So they're saying that yes, there are some medicines you can take that include things like I think on page 745 they talked about the SGLT drugs that are helpful and kind of inhibiting absorption of glucose, so it kind of goes out of you instead of into your body. They have other medicines like the GLP-1s, which are really good at suppressing, things like glucagon secretion, increase in insulin sensitivity, slowing gastric emptying so you feel full. It helps you lose weight. And then they have other medicines like non-steroidal mineralocorticoid receptor antagonists. Sorry about the big words, guys, but they're basically saying that these newer drugs are critical in preventing or delaying the progression of kidney disease and type 2 diabetes. So a couple of thoughts on this before I hear your thoughts, Ade. Um, I love the fact that we have these new drugs available that help us improve our diabetes control. And they're finding that these new drugs don't lead to heart attack or stroke. Ironically, this is the irony. You would think that all drugs don't still lead to heart attack and stroke. Well, guess what?
I know.
This is not.
Why would you take something that leads to that?
I know. I'm sorry. Pause for a second. This is not medical advice. This is just Dr. Hampton and Ade having a conversation. But when they've done the cohort studies and advanced studies and the VA diabetes prevention trial, if I'm naming all those right, they all showed that even when you tightly control the blood sugar, you still have a heart attack or stroke. So they had to
Mhm.
stop half these trials. So, but my point is this: the question is why? In my opinion, I can give you my reason, because most of the medicines they were using were insulin and drugs that increase insulin, and too much insulin is going to increase your risk for cardiovascular disease. It's hyperinsulinemia, leaving the so even if you have a number that looks very favorable, your blood sugar looks okay, your risk is still there. Thankfully, a lot of these new drugs that don't increase insulin, or like a GLP-1, it helps the insulin to work better, but it doesn't give you excess insulin. It would make sense that those drugs would not increase your risk for a heart attack or stroke. So to me, it's very logical. But the key message is this: wouldn't it make more sense to just reduce the insulin burden? You just don't give your body the foods that will make you have too much insulin being made,
Mhm.
and then you can reverse your disease with that. Because most of these drugs, if you look them up a day, they reduce your hemoglobin A1C, that 3-month sugar test. They'll reduce it by 0.5 or maybe up to 1.5. That's it.
Mhm.
So, but if you do what we're talking about, lifestyle, you can go from like an A1C of like 12 down to like 7 in no time, and
Mhm.
without the potential side effects of the medicine. So I just want to emphasize, I appreciate them sharing the good news that these newer medicines can help us and not harm us as much as some of the old medicines. But the message I'm sharing is that lifestyle is the key. So, and one more thing about this, we were talking, this is about kidney function, right? In my career, I've been practicing, it'll be 29 years in 2022, right? I don't think I've ever seen anybody kidney function get better with medicine, ever. With low carb, it happens all the time. So if you're looking to improve your kidney function, I got some good news. There's a diet that'll help you do it. So what's your thoughts on this, AJ?
I agree. I mean, I have interviewed several people with chronic kidney disease for, various reasons, and they have started the carnivore diet, and their kidney function has improved. And
Yeah,
all of them have told me their doctors, say you're never going to improve. Best case
right.
scenario, we slow down
That's right.
the decline. And so the doctors are like, I don't know what you're doing. Whatever you're doing, I don't care how crazy it is, keep doing it. So they are like carnivore, eating only meat. Weird, but keep doing it because it's working. So I don't know. I mean, I think I'm glad that there are doctors out there that, recognize that something miraculous is happening and they want to get out of the way of it, and they, encourage the patients to continue. But yeah, it's definitely, not an uncommon thing to see these kinds of improvements, and I'm glad for it.
Yeah, absolutely. And I think the last thing I want to point out in the document was page 745, talked about the coronary artery calcium score test. And they said that that could be a great surrogate marker for atherosclerosis. And I thought that was huge because I've been ordering that test like crazy. And they also said the absence of a coronary artery calcium can reclassify up to a third of patients with diabetes to a low risk category. This is huge. Whereas higher calcium scores may prompt tighter, um, you know, risk factor control, and that includes things like statins and aspirin, right? So, what's huge about this statement in layman's terms is that they're saying that if you have a low score, maybe you don't have to take a statin.
Mhm.
Huge, huge. Somebody's gonna be mad in the pharmaceutical industry because I always tell patients, if you have a 0 calcium score and half the time their cholesterol looks okay, and then somebody's telling you to take a statin, pause for a moment
Mhm.
and ask yourself, if I'm 65, don't have any plaques, and now you're asking me to take a medicine with potential side effects. Is the risk benefit justifying that? And I would argue probably not. I think every decision that's made about this should be individualized. There's other factors we're not touching on, but I am completely a fan of getting a coronary artery calcium score test. In the article, they talked about, they compared the coronary artery test, which is basically looking at plaques in your arteries, to other tests: coronary artery computed tomography, angiography, cardiac magnetic resonance. I'm sorry about the big words. Stress testing, and
Hmm.
cardiac positron emissions tomography. Pause, rewind, look that stuff up, guys. We don't have time to go into details about these different tests. But imagine this, guys. In our health system, shout out to Advocate Aurora, we have a calcium score test that costs $49. Now, what do you think of?
Wow.
Amen. So, what do you
That's
think of?
less than like two people at McDonald's, or, that's
Especially in New
less
York,
than
right?
one. Yeah, that's less than one dinner out. Like, wow.
And let me tell you what's cool about this test. First of all, those other tests, what does a stress test cost? I mean, really, what do you think? I mean, it's not $50, I can tell you that. So imagine not only getting a heart scan and look at your arteries, but guess what? When I get those test reports back, oh, we looked at your lungs. Oh, we looked at, they actually find other stuff because it's really the whole chest. So you get
Hmm.
this value proposition for $50. I'm not saying it's $50 in every health system, but it's probably going to be 75 or 100. It's not a ton of money, but yet it's more predictive than all those fancy tests I just mentioned. That's huge. So I think that's another
Hmm.
huge thing that we probably need to make a video about one day, that really emphasizes that you need to get that test. It's probably the best predictive of a future heart attack. So let's I kind of know your response to that concept is you're amazed and happy about it. Yeah, so I don't need to ask you that, but I do want to ask you, where do we go from here? Because I think that we're I literally had another podcast that I was going to record for this week, and while I was sharing the news with you, I was thinking I need to make this the podcast because I think it's too important to. And again, I mentioned and people who are listening, you should just search American Heart Association position statement, March 21st, and just see what comes up. And if you don't see a lot, that's why this podcast is important. So you should share this podcast with anybody that needs to hear this information until CNN, NSBC, and Fox News gets the memo. So for me, I think that what I just said is what I think should be our next step. Uh, you know, we should spread the message so that more clinicians are given permission to use therapeutic carb restriction in their diabetic patients. I would argue in all patients with chronic medical conditions, since mostly we talked about cancer and dementia, all these things are the same. I did do a website tour, which we haven't released, with the Society of Metabolic Health Practitioners and with Pam Devine. So I think that that's a good uh, website and organization, because their job is to spread the message about metabolic health and how to achieve it. And although you can do it with many dietary patterns, we all realize that low carb is one of the best. You can also see the work that Low Carb USA is doing. So I think we should just help spread the message and join others to share this good news. And when you think about how we can do that, Ede, what comes to mind? I'm sure that's of interest to you.
Yeah, well, I think to highlight, the specific parts of the paper that were so important. When I posted on Instagram, I posted like a screenshot of like the actual page, but I pulled out the quotes that I wanted people to most be aware of and put them in the body of the
Mhm.
message. And I actually saw that my post was actually shared, like, I don't know, close to 45 times.
Good.
So it was just a really easy way to consume the information and share it around. And then I also provided the link to the full article. And I loved too what Ken Berry said in his video, that just came out was, print out this article, bring it with you
Mm-hmm.
when you go to the
Mm-hmm.
doctor, highlight these portions, and be able to say to the doctor, so here's the latest information. How does this change our treatment plan? And I think that that is really important. Like, we are going to have to do the work, the legwork of getting this information out there, of educating our own selves and of educating our doctors. And unfortunately, I don't see any way around that. Like, we are
Yeah.
just going to have to stand on the
Yep.
rooftops
Yep.
and shout
Yeah.
about it. But now, every time somebody says to you, well, what about your cholesterol? You can say, here's the paper, read that,
Mm-hmm.
and then let's come back and discuss it. And then they're never going to come back and discuss it. But you've got something to say. The American Heart Association says that this is a viable option.
Yeah, love it. And that's exactly what I wanted to do with this podcast is to stand on the rooftops. We're shouting together. And I really appreciate you joining me. And I look forward to us continue to spread this message. And again, we all have to do this together. I know I asked you this at your last podcast interview, but where's your focus when it comes to the nest and rope? Where are you focusing your attention to make sure A Day is around to help spread these messages of healing?
For me specifically, I have been doing a terrible job because I've been so focused on building building a business and trying to get the message out there and do it in a way that makes sense to people and provides the support that they need. So I like work, from morning to night. And my poor dog, we have not gone to the park like we're supposed to.
Hmm.
And I haven't been taking the walks that I'm supposed to. But one thing that I did do the other day was to download. I found adult coloring books for Black women, and
Nice.
I downloaded a digital version. And so on my iPad, I've been coloring, and that has been a lot of fun, and that has helped me to relax. So let's see. I think, yeah. So you can see, very pretty.
Yes. Nice. Yeah.
Ah.
Share that with me because I think that's like meditation. So
Mhm.
share that with me so that those who want to have that, I may purchase it as a gift. I think that would be cool. So thank you. That's totally not what I expected to see, but that's cool.
Well, I am very much an artist, and I just,
Cool.
I haven't given myself like the freedom and the time. But having a coloring
Yeah.
book, like, it's just easy, and I can kind of come in
Yeah.
and out of it, and yeah.
That's right.
So it only takes a few minutes to just set up and mess and all of that.
I
But
love it.
yeah, I mean, I do think it is really important, and I'm always encouraging people, like, what are your passions? What do you like to
Hmm.
do? What are you not doing because you're too heavy, too tired,
Hmm.
to whatever? Like, let's do those things. And so I'm not really taking my own advice, but I started doing some art, and I my next thing is to add on daily movement. And I think I need to really sweat every day.
Cool. And
Hmm.
again, just to remind people who may look at us as different, I was listening to how Barbara Streisand was watching The View, and they were like so shocked that she was watching The View. We're just people, guys. I mean, we're all struggling through this life. We're all trying to get better, and that's what it is. So even the Black Carnivore who's teaching others is on a journey, and I appreciate you sharing that. Where can people find the work you're doing? Why don't you share that as we wrap up?
Yeah, so you can start at blackcarnivore.com, and you can download a free 3-day meal plan for if you decide you want to give carnivore a try. You can do it for 3 days and see what you think. I also do a monthly 21-day challenge. So you can find that at blackcarnivore.com/challenge. You can also find me on YouTube at Black Carnivore is the name of my channel. And I have like a ton of interviews of people who are eating this way and who are finding success. And really, I wanted to elevate our voices, our stories, and allow people, anybody else who is who's Black and thinking about carnivore to see that there is a thriving community. We have a huge Facebook group. So if you're interested in this lifestyle, come join the community. There's other people who are like you. And finally, you can find me on Instagram at Black Carnivore. If you wonder what to eat, what do I eat? I have pictures of all of my food there, and you can see what I eat. It's really, I try to like make it pretty and interesting, but there's only so much you can do with brown food.
Yeah.
So,
Right, but well, you do a good job, and I've seen those posts, and again, I don't see why it's hard to eat this way at all. So thank you so
mm-mm.
much for the work you're doing. I appreciate you. We kind of got this together at the last minute, so thanks for skimming through the article and and me as well, just trying to get this information out. And I appreciate you. So thank you so much, Ade.
Thank
All
you.
right.
I really appreciate your having me.
Oh, yeah, absolutely. And for those who joined us today, I am so excited that we've gotten this news out. I want to thank Dr. Kim Berry again for, making sure we all heard it, and my partner here, Ade, sharing the good news. But I think we should pause and reflect on what the American Heart Association statement could mean. My hope is that the work we are doing in the low carb community, sharing this healing message of low carb will have just be a little easier now. So that because now we have these major organizations starting to understand and follow the science, just like Nina Teicholz asked us to do, which has clearly shown that a low carb diet is an effective way to achieve metabolic health. Maybe now clinicians who were curious about low carb, keto, and carnivore will be willing to try these dietary patterns themselves or with their patients. And guess what? I've seen in my clinical practice a transformation. I've become a doctor of healing versus one who focuses on disease management and symptom suppression. Today was not just a chat with a like minded friend, it's really a call to action, an opportunity to share the American Heart Association statement with friends, family, and of course, your clinician who has been fed for years the false narrative that low carb is dangerous and that low fat is the key to healing. Today, we have additional evidence that there's no need to fear a diet that has helped millions around the world heal from chronic diseases. So join us as we work to help spread the good news by sharing this episode of the podcast, the American Heart Association statement, as well as the therapeutic guide to carb restriction, which you'll find again on the Low Carb USA site and the Society of Metabolic Health Practitioners website. But I'll make sure to have a link as well in the show notes. Um, and again, reminder also, I'll be sharing a video about the Society of Metabolic Health Practitioners website. It's kind of a website tour. And as soon as that video is ready, I'll make sure to have it in my link tree. Dr. Tony Hampton Linktree is where you'll find my additional content. So I thank you again for joining me on this episode as we hear the ambulance go by, which is appropriate
Sorry.
because this is an emergency. This is an emergency. We got to get this news out. So I'm happy the ambulance went by. And as we wrap up this episode, I ask that you be safe, be well, and continue to protect your nest. And thank you again, Ade, for being here.
Thank you. Bye bye.
Mhm.